And welcome back on Bernama Today. It's still with me, Elaine Nobla, and in the studio I'm speaking to the lovely Dr. Alice Prethima Michael, of course, founder of Dr. Alice Medical Center, our total wellness guru and consultant. Hello and welcome, Doctor. How are you doing today?
Very good, thank you. You look lovely.
Oh, thank you. So do you. And you're looking lovely today in red and black. We're bringing the siren back today. It's a terrific Tuesday. And we're talking about, looking good and keeping yourself spruced up. Now, a lot of people are a little bit concerned when you're aging and you want to, you don't want to think of cosmetic surgery because a lot of people think it's invasive.
Yes.
So, you don't want to have the downtime, you don't want to have scars, you have a lot of concern.
Yes.
So, what do we do? Is there an alternative to this?
Yes, because aging is something that we can't run away from. And it's very true what you said, Elaine, because people now want to be naturally beautiful.
Yes.
They want to still maintain their youthful beauty.
But looking like they're not doing anything.
Looking very, very natural and not actually changing any of their features or anything like that, which may be a no-no, but we have worked with many technologies over the last 20 years of my practice in this line. We've used many technologies, but the only technology where we can use to combat all the signs and the problems of tissue aging around the face and the neck areas, then we have our latest method. It is not really very latest because we have used it for more than 6 years now, but it is the only FDA approved technology for actually lifting the tissues of the face and neck without any kind of invasion at all, in the sense that we go from the top layers of the skin, but the top layers of the skin are not really affected by this treatment. Basically, we are working with 3 different layers of the facial and neck tissues, which actually ages as we go through the decades.
And this is called Ultherapy?
Ultherapy, basically because it is using the beauty of ultrasound waves, but it is it's not an ultrasound as in a normal cleansing or something. It's actually a micro-focused ultrasound, and it is the only one of its kind, even though there are some copycats, but they actually don't work the same way. As in any good things, there always tends to be copycats, right?
Yes, that's right.
Yeah, but it doesn't work in the same way. So till today, over the 6 years, it's still the only microfocus ultrasound for lifting.
All right, we'll have a short video. Let's take a look at the short video before we come back and explain it a little bit more.
Hello viewers, Ultherapy is the only treatment that is FDA approved to actually lift face and neck structures. Of course, there's many other devices you may know of, radio frequency or lasers. Lasers just work on the top layers. Bulk heating with monopolar or unipolar radio frequencies work just under the skin, whereas for a good tissue and face and neck lifting, what we actually need to do is go to the deeper structures of the face. That means we go to the SMAS or superficial musculo-aponeurotic structures of the face, thereby triggering the collagen and letting the collagen to grow, because we are stimulating the collagen with focused ultrasound rays, and that is Ultherapy. And we can do this treatment in 3 different levels. This is called the Deep Sea technology, and the Deep Sea actually allows the doctor, that is me, to actually know where I'm shooting the ultrasound waves. So the Ultherapy treatment can be focused on, this one is if we are using a 4.5, then we are focusing more on these areas of the neck and the face, tightening the tissues that is supporting the muscles, because facial aging starts with sagging, that is at the muscle layer, and then the second layer, which is 3.0, which actually treats somewhere in the middle, and that's the treatment we will be demoed today, which actually treats somewhere in the center under the skin area, where the fats and the collagen tissues are holding up the skin and underlying structures. So when we stimulate with the pointed ultrasound rays, which is high intensity focused ultrasound waves, what is happening is an immediate collagen reaction, which we can see as a 10% lift or stimulation effect on the areas treated. And as you can see, the 3.0 handpiece can actually treat all the areas of the cheeks, the neck and the under chin areas, periorbital or surrounding the eye area treatments, and also to improve the temporal area or the temple area, as a layperson calls it, and then giving the forehead lift, thereby working from the brow upwards for the vector to actually lift and tighten tissue. And then the third handpiece would be a 1.5, which is actually working at the subdermis or just under the skin to stimulate the skin from preventing it from wrinkles and superficial skin sagging as well. So today, because of the time constraints, we will be doing a demo for the 3.0, and you can also see how the Deep Sea technology helps the doctor to deliver accurate treatment to the right places.
So we saw a description of the Ultherapy. Perhaps, doctor, you can tell us what kind of results will you see after you've done one of those treatments?
We see almost across the board for everybody, we see at least a 10 to 15% of the lifting that we are able to, that we want to achieve. That's our goal and the aim. Okay. So basically we are working, if we work around under the neck, the jawline and so on, we would be able to see the lifting on that area, which is not 100% lifting as what you can see with the surgery. It will be immediately there, but of course with surgeries you will find that there is downtime, right? There will be some swelling, there may be some bruising, it may take you a couple of weeks to gradually come down. But this one does not have any kind of downtime, in the sense that there is no redness, there is no, basically there is no injection, so there is no points of red marks or bruising or swelling at all, but it's just you can see the lifting. Most noticeable, I always show my patients, would be in the mid-cheek area, around the jawline. You can see the sharpening of the jawline because the tissues under the chin and also above is all tightened and pushed up, and you will definitely also be able to see the eyebrow temple areas lifting up. And over the course of the next 2 to 3 months, and we normally assess treatments for a full result at 4 months, you would see a lot of changes, which comes on gradually, which a lot of my patients love too, because it's very subtle, but it starts to show the freshness. So if the person were to go for a function or a party that weekend, or even in that on the same day evening, they actually look a lot better than how they did before they came in. But that's not the final result. It's going to improve. Nothing they need to do anymore. They just need to have a good set of skincare to maintain, you know, not do harmful things for themselves during this time, and you find the results will get better and better. So it gives a non-surgical facelift result. Basically with other technologies, as I was talking about, lasers being able to work only on the top layers because they are sensitive to color. Laser rays go to color, colored areas, so then it's only the skin. Underlying tissues like fat tissue, collagen tissue, the SMUS, the muscle layers that is holding up the muscles, all of them being transparent. They don't really have color in them. So that is why we need the ultrasound energy, but in a fractionated way to actually trigger and stimulate. And so far, by far, before Ultherapy, we were not able to reach the SMUS in any way. And SMUS is only reached in a SMUS plication or a SMUS facelift, which is a major procedure. So now we are able to do this for people who do not want to do surgeries for any reason, or even for people who have done a surgery before, but of course there's always a maintenance. The minute you stop doing something, there's some improvement and then there is deterioration. The body doesn't stay in that same plateau for very long. So then to maintain, so maybe after a few years after a facelift, we would still do this treatment to maintain the results of the facelift. For younger people in their 30s, sometimes their major concerns being the wrinkling, the dryness, the not good texture of their skin. We use the superficial handpiece 1.5, which can actually, without any injections, without any kind of surgery, able to sort out their fine lines and wrinkles and hydration issues.
So what is the frequency? Doctor, you mentioned earlier 3 to 4 months you'll see quite drastic results already. So what's the frequency in this 3 to 4 months? Is it a once a week program? Is it a couple of times a week that you need to go? In terms of course, optimal, you can always go more, I'm sure, but what would be the optimal time to see decent results in the 3 to 4 months time?
No, it's actually just one single treatment.
Oh, one single treatment?
One single treatment. We work with a medical protocol. The pictures that you saw, you know, the diagrams, it actually comes with specific protocols. That means it guides the doctor as to deliver how much of energy and so on. But of course, there's always a learning curve for delivering all these treatments.
Right.
And so we develop more lines that we can do in different vectors to give even better results. That's what I do, because I pride myself on my ability to give better results.
Yes, there you go.
Whatever technology or technique we use.
Okay.
But we just do the treatment once to get the satisfactory results. And we would not, unless there is any specific collagen disorders or some uncontrolled diabetes, things like that, where you may expect the collagen not to, you know, really grow and support the tissues as much as for any other person, then we may repeat it. But otherwise, we don't normally repeat it. At least for a period of 6 months, I would not repeat it. Okay. Because even though we say best results by 4, it does maintain very well over the next 6 months.
Okay.
So there's really no necessity to repeat it.
Wow.
And only upon signs of further, you know, sagging, which may happen according to how you maintain your internals, which we always talk about. Beauty is from within.
From within, yes.
How you maintain your nutritional needs as you grow older, and how you wear protection, because protection against the sun, against harmful environmental, you know, damages is by using appropriate skin care, which is sunblocks and vitamin C's, all of which we actually propose to our patients. Nothing else is necessary to be done. It's just one single treatment.
Thank you, doctor. Thank you for sharing that with us. Now, if you're looking for a single, one-time, quick, non-invasive facelift and tightening, this might be the solution for you. It's called Ultherapy. Look for Dr. Alice Prethima Michael.
Yeah, I have one small tip.
Yes.
We are actually having an event called Natural Beauty, because I always like to propagate natural beauty among my patients.
Yes.
So, of course, any of you viewers who are very, you know, keen to know about methods to enhance natural beauty, feel free to, you know, approach us and you can take part in our event, which is on the 6th of August between 11 a.m. to 4 p.m. at my center.
Okay,
in Bangsa.
there you go.
Yeah.
August 6th, the place to hit is at Dr. Alice Medical Center in Bangsa. You can, you know, get freebies. There's activities going on, so you can find out a little bit more and meet Dr. Alice and ask her all the questions that you need to ask. Now, that's all the time that we have, Dr. Alice.
Thank you.
All the best for the event. We hope that, you know, you have a successful event. We'll take a short breather right now. When we come back, we have more stories to share with you. And later on in the show, we have another special guest. Stay tuned. We will be right back.